So this session is on infection control. So first point there is prophylactic antibiotics. If people have severe infections, they shouldn't really have surgery unless it's an emergency surgery or can't wait, like you're having a baby. But antibiotics are controlled in hospitals by stewardship programs. The bigger hospitals at least have stewardship programs. And it means the hospital prescribes to doctors exactly what antibiotic to use, how many doses, and how much. And this way we try to prevent the overuse of antibiotics creating more multiple resistant organisms. Second point there is surgical aseptic non-touch technique. So when doing surgery, we try to use sterile instruments and keep the sterility intact and only contaminate the instrument with the patient's own flora perhaps, but do know that internally your body should be clean from bacteria, so it's just the skin. So the skin will be prepped with chlorhexidine gluconate, and sometimes even a clear film is put over the skin, like in orthopedic surgery, so that no skin flora can access the wound. Then warming, so this is usually underemphasized, but warming actually guarantees proper perfusion of areas, and it's very important that immune cells and immune factors can reach for the surgical wound site and protect the wound site from bacteria entering the body and to a degree also viruses. And then we're looking at multiple resistant organism and related precautions. So there's three types of precautions. The first one is contact precautions. So these microorganisms only transmit by anyone touching a contaminated site, and then with the contaminated hands usually touching another patient or instruments or equipment, and so create a cycle of contamination and recontamination. The COVID-19 virus, for example, is transmitted via contact. It's been said that the coronaviruses can live up to 9 days on surfaces like plastic and steel. And so cleaning of the surfaces is very important. The coronavirus, for example, has a lipid envelope, so normal detergent will break that lipid envelope, but also alcohol, and therefore destroy the virus. But for bacteria, most bacteria, that's the same. The second type of precautions is droplets precautions. So that's when people cough and sneeze. A good example is now the COVID virus that's transmitted in this way, and therefore people should protect others by not sneezing over the top of them or coughing over the top of them, and they could wear a face mask to protect any droplets not from entering the surrounding area. Then the last precaution is that of airborne precautions. So for example, chickenpox is transmitted by airborne transmission, and protection there is the N95 mask, also referred to as the duckbill mask, because some of the N95 come into that shape. So the last thing there is mentioned, the COVID-19. With COVID-19 patient, we have a huge protocol. It's too hard to describe here, but particular the doffing of personal protective equipment has to be done immaculately in a joint effort with a partner. It's been shown that particular doffing personal protective equipment is a moment where healthcare workers get contaminated.